everyone, welcome back to my channel. So today I want to talk a little bit on Med-Surg and how to study for this class, because as you know, it's an important class. You know, there's so many things that you have to know, especially the patho. You need to have it down, the pharm, the intervention, the whole critical thinking side. So I'm going to share with you guys some of my notes, like how I set up everything and color coordinate things, or even draw. I'm getting better at drawing. I'm not good at it. I'm not an artist, so yeah. So I'm going to show you guys how I do it, and also the resources that I have or what I used for this class. So don't worry, I will have my notes set up on the link below so you guys can have it, and it's for free. But like here, it's hard to see, but like this is for cardiac, the chapter. I kind of included all the important things I needed to know on one page. So as you can see, like this is a heart, and this is something that you learn in you should know in anatomy, what other class? Patho, and then it comes back again in Med-Surg. So this is a heart, and then it goes into, as you can see here, it's hard to see, but like I go into the SA node, AV node, bundle of his, and I incorporate it in the heart. And then you could see here the EKG. There's like little side notes that I put in here. And then I also put like things that can increase blood pressure, or medications, anything that can affect the blood pressure and the cardiac output. And then another, like they like to add select all applies on these things. It's the right-sided heart failure and left-sided heart failure, and then the peripheral vascular disease here. These symptoms, let me tell you, they like to throw select all applies on these because it's so easy to get them confused. Especially for me was the PVD. Till this day, like I have to like go back to it and look at it. The right side and the left side is, I got it down because I think of it like left side is the lungs, anything like congestion in the lungs, and then the right side is the everything else, like the rest of the body. So left lung, right rest of the body. That's how I think of it. Yeah, so I like to put all my notes on one page. You guys will have access to this, so don't worry. Here's another one of my notes. These are all the dysrhythmias. You know, my drawing is not perfect, but I try. I'll have, you know, all like the normal sinus rhythm, bradycardia, tachy, all the AV blocks, and then here are some assessments that I like to include. So, you know, you kind of have an idea, you know, what to expect if someone's having dysrhythmias. So these are just my notes, like for me. And then what I like to do is concept maps for all the diseases, because I like to see everything on one page. I don't like to be flipping back and forth. I like to have, you know, like, for example, pneumonia. Like, I'll have everything that I need to know on this page. Okay, like sometimes I do, like I'll test myself, you know, I'll kind of fold it and then I'll be like, okay, what are some diagnostics for pneumonia? How would you know? Or what are some care? What are some interventions that you'll do for pneumonia? So I like to have it all in here, all on this page, and I'll honestly do it for every disease process. Like here's another one, the coronary artery disease. I'll include like drawing like the phases, the types of anginas. I have everything here. Let me see if I have another one. Yeah, see, like diabetes. And I have this for the whole book. Like I do these for the whole book because, you know, there's sometimes there information in that big book. I forgot the name of the book now, but the course book that you're going to be reading, there's so much information in that book that some things you're not going to even like need to know. You need to grab like the main one. And then this, we used to have study guides. We don't anymore. They took it out because they're like, oh, we're relying on the study guide. I never did. It was kind of like to narrow things down. But yeah, these are some of the stuff that I would do. Like the professor will say like, no, UTI. So I'll basically just write down, you know, all the clinical manifestations. Same thing, same idea as this concept map, this one, except it's typed up. It's just an easier way, you know, if I'm lazy to write, I'll just type everything up. It's not bad. And then another thing that I want to tell you guys that what I used, sorry, like I don't want papers like flying around. It depends on the school, but like we have to use ATI, so I related everything back to this book because it kind of breaks everything down, or I mean not so much about breaking it down, it just narrows things down. Let me see if I can't find it now, but like I'm on the respiratory. I'm trying to find pneumonia because I showed you guys in here. I thought I had saved the page. I guess not. Oh, okay. Whoa, this book is big. See, this is pneumonia, and then it has everything you need to know in here. So it's kind of like you're doing your own version of this, like your own notes of this. So it really helps when I'm the type of person, when I write, I'll remember. And if I have to include colors in there too, like colors rule. And I'm so sorry for this one. This one is crazy right now. And after I read my course book, not everything word for word. Like it's honestly impossible. There's no way that you could read the whole book. And it's not even just reading the whole book. It's like so many chapters within a few days or a week, you know? You have to be quick. So I look at the course book, I refer back to the ATI book, and I like to do, you know, my concept map based on, you know, the course, like the book that we're going to be using in class. And after all of that, I use my Saunders book. I talked about it in one of my other videos. It's the same thing as the ATI. Like honestly, like I've compared both of them and they're both great resources. So whatever works for you. Like this is what I've been doing for Med-Surg, and I got a B in this class, and I am proud of that B. Yeah, because this class is, I mean, once you have Med-Surg down, you are good to go, honestly. And you're going to have clinical experience, so that will help you, you know, visualize and understand. Like I didn't really know what diabetes can actually do to your body. Like I thought, I was like, oh, you have diabetes or whatever, you know, just go on a diet. And it's like, no, it's serious. It's very serious. And you have to take, you know, like I guess like once you start thinking as a nurse, you know, you start like analyzing, critical thinking, and being fast on your toes. So you take initiative and you're always educating your patients. So take these books seriously, like really go through them, read it, do your own notes, try to understand it in your words. I'm like gonna advertise here now, but like I love looking at the videos on YouTube on Armando. He's like the only one I look at on YouTube is his patho. Like I love looking at his patho because he really draws everything out, breaks it down like into the cells, so you really understand like the patho behind asthma, or you know, vomiting, whatever it is. Like it's really cool, and I highly recommend going to his YouTube. And yeah, and I just want to take the time for you guys to pray for Florida right now, because we have, I don't know if you guys are watching the news, but we have Hurricane Irma coming here, and she's a monster. She might be a category 5 or 4, but either way, like we're gonna have storm surges up to like 10 feet, and just pray for us that it's not as bad and that everyone is safe, and you know, just pray for us and think about us, because like we're really scared right now. We're actually in the midst of putting shutters, so I didn't want to like do like this video after the hurricane, because I honestly don't know like how things are gonna be. So yes, we are in the midst of preparing, and I'll keep you guys posted after the hurricane. Hopefully, you know, everything is good and my house is still standing and strong and I don't lose anything. We're gonna be out of school I've been out of school since Thursday. I took my exam on Wednesday and I got an 85 in peds on the ATI. So that ATI, let me tell you, is like not fun. Like, I hate those questions so much. But yeah, I got an 85 on my peds, so that's good. So we have now a week to learn all of respiratory for kids and cardiac. So I guess during the hurricane, if I'm safe and my house doesn't blow away, you know, I'll have time to study with my flashlight or whatever I can. But as of right now, we don't have school for a week. So we'll see how that goes. But please, please pray for us, you know, and that God like moves this hurricane out to the Atlantic Ocean and like just disappear, because no one wants a hurricane right now. But alright guys, I'll keep you guys posted and I'll be back soon. Bye.